This is the media launch of the People Hull campaign. The People Hull study is a study which is about improving outcomes for lung cancer and serious lung diseases in Hull. And we're doing that by having a media campaign to increase awareness of symptoms. That media campaign will encourage people to go and see their doctor if they get symptoms.
It's hugely important to us. First of all, it's around lung cancer, which is Yorkshire's most common cancer, and therefore a vital issue for us. And it's around early diagnosis, and early diagnosis is really important for all cancers, but in particular for lung cancer. Hull, unfortunately, has a significantly higher than average number of lung cancers compared to the rest of Yorkshire. So obviously it's a key area for us to be working in. We need to work in the areas where we can make the biggest impact, and with lung cancer then Hull certainly is one of those areas.
Of course, all these symptoms are very, very common, and they can happen very acutely, so over a very short period of time, and be associated with a viral type infection or another chest infection. And of course, those symptoms then tend to resolve equally fast over a period of a few days to weeks. But certainly if you've got persistent symptoms that are carrying on, or these symptoms keep coming back, then they can represent an underlying health condition. So it could be a chest condition, such as COPD, which is smoking-related lung disease. It could be asthma, or something similar. So it is important to go along and get those checked, see if there is anything else going on to explain those symptoms, and then getting those treated. People do worry about sometimes going to the doctor, and doctors often do find things. But I think the key thing is that ignoring it doesn't make it go away. And what's happening in that condition or that process that's going on that's giving those symptoms continues as long as you ignore it. And of course it can get worse and progress. And as long as that's happening, damage can be done that sometimes can't be undone. So it is important to try and present early, to treat that condition, to prevent that from progressing, and to make you feel better. So I think the key thing is saying ignoring it doesn't make it go away. There's often things that we can do that make you feel better. And by presenting earlier, we can make you feel better quicker.
If you yourself, or if you know someone and you've noticed that they've become more breathless, or they've developed breathlessness, or you've noticed they have a new cough, or a cough that hasn't gone away, or if they have a sort of chronic smoker's cough, if that's changed, if you notice any of these things, if you encourage them to get checked out. So by getting checked out, we mean go and see their doctor. So either make an appointment with their GP, go to extended access, which anyone in Hull can do, go to one of the drop-in GP centres.
It's about the biology really of the cancer. So when the cancer first starts, it tends to be in one place, and as it gradually gets bigger in size, it might involve vital structures that a surgeon can't remove successfully, or the radiotherapy is too big for successful treatment. The earlier we get the cancer, the smaller it will be and the less chance it's spread.
But it's about making a difference. It's about, at the end of the day, people getting diagnosed with serious illness earlier in the course of that illness, at a point at which where there can be an intervention and a treatment that will cure them.